Hello, and thank you for joining us for this instructional video. Today, we will be demonstrating how to insert a Foley catheter into both female and male patients. This video is made through simulation and learning resources within the College of Nursing and Health Innovation at Arizona State University. Some indications for urinary catheterization include relief of urine retention, bladder decompression for during and after surgery, accurate measurement of urine output, as well as for diagnostic purposes. Inserting a catheter for urinary elimination can be a traumatic event for the patient. The nurse needs to provide information and support at the level of the patient's understanding. Our nurse, Christy, will demonstrate this throughout the procedure. It is also important to note that an indwelling catheter is the most common predisposing factor for a hospital-acquired urinary tract infection, so careful aseptic technique is required. Pay attention to how Christy maintains sterility during that part of the procedure. The first step in performing a Foley catheterization is to verify the order, policy, and protocol of your facility. Then it's time to gather your equipment, which includes items needed for perineal care, which may already be part of some kits, the Foley kit, 1-inch tape or another securing device such as a stat lock, and a flashlight if needed. A 14 or 16 French catheter is the most common size used for an adult. A pediatric patient will require a smaller sized catheter. Remember, you will be documenting following the procedure, so it is important to observe and take note of the date, time, size of catheter, color and clarity of urine, amount of sterile water in the balloon, any difficulties encountered during the process, as well as the patient's response. Now let's watch Christy as she performs a Foley catheterization.
Upon entering the room, provide for privacy, wash hands, introduce yourself to the patient, and explain the procedure.
Good morning, Ms. Perez. My name's Christy. I'm going to be your nurse today. How are you? I see that you're going to get a catheter today. That's just a small tube that's placed in your bladder. It'll help with any pain after the procedure, and it'll help us keep track of your urine count. I just need to make sure that you are indeed Ms. Perez.
Notice how Christy checks the ID band to verify the patient's identity.
Yeah, all right. Do you have any questions? All right, I'm going to go get all my stuff ready.
Raise the bed to a comfortable working height. Before you begin, wash your hands, remembering to scrub for a full 20 seconds. According to Potter and Perry, the friction of rubbing hands together removes soil and transient organisms from the hands. Contaminated hands of healthcare workers are a primary source of infection transmission in healthcare settings. Wet hands and wrists thoroughly under running water. Keep hands and forearms lower than elbows during washing. Rub hands together vigorously, lathering thoroughly and using plenty of friction. Interlace fingers and rub palms and back of hands with circular motion at least 5 times each. Rinse hands thoroughly, keeping hands down on elbows up. Dry hands thoroughly from fingers to wrists and forearms with paper towel. Turn off the hand faucet, avoiding touching the handles with your hands. Don clean gloves. Talk to the patient as you get ready to perform perineal care. Reassure her during this time as she may feel vulnerable.
All right, Ms. Perez, I just need to uncover you a little bit here.
Position the patient, typically by pulling the knees up. Drape the patient to allow for maximum visibility while maintaining privacy throughout the procedure.